our distinguished speaker, Dr. Arowy, a veterinary in field of dental practice. Dr. Baqsami is not only an expert in blending art with science in dentistry, but also she's an estimated founder of Arta Medical and Beauty Supplies, a company that reflects her passion for advancing dental and aesthetic care. Today, Dr. Baqsami will be sharing her insights on the art of science in dental practice, highlighting how innovation, precision, and creativity to improve patient outcome and elevate the dental professions. Please join me in welcoming Dr. Arowy to the stage.
Thank you, Dr. Dua, for the great introduction. A lot of people ask me, why did I call the brand Arta? Is it because my name is Arowy? And the answer is no. Arta means art in science, in Greek, and it also means the golden standards, which is our aim when we created Arta. So why did we create Arta? We created Arta because we were inspired by our patients. When a patient comes to me and they tell me that they have a problem with using a certain product or sticking to their oral hygiene routine, I think it's my responsibility as a doctor to take care of them not only in the clinic, but also out of the clinic at home. So this is when Dr. Nal and I decided to found Arta back in 2022, and we wanted to take the oral hygiene to the next level. So let's talk about Arta products, the reason why Arta's vision has turned into life. So I'm going to be discussing some problems that we are facing with our patients in the clinic, and how did Arta solve these problems. So the first problem I'm going to talk about is when the patient says, I don't have the time or the energy to clean my teeth for 3 minutes in the morning and 3 minutes at night. And even though you have explained the right technique of brushing for me several times, I still don't know how to do it right. So Arta solved this problem by creating Express Ultrasonic Toothbrush. Express Ultrasonic Toothbrush, it's a triple head toothbrush that brushes the 3 surfaces of teeth at the same time: the lingual, occlusal, and the buccal or facial surface. So this way, we don't have to depend on the patient's technique while brushing, and we created a brush that brushes for the patient rather than the patient trying to figure out how to brush every time. So this design was new to the Kuwaiti market, so I was a bit afraid that patients will not understand how to use it. So I did provide a single head toothbrush, 2 types. One is for sensitive teeth and gums, and the other one called gum stimulation, that basically massages the gum to stimulate keratinized tissue, which will aid in healthier gums. In this case, we applied a disclosing agent to the teeth, to the patient, and we asked her to use Express Ultrasonic Toothbrush, and this is the result after 1.3 minutes only. And I think it's a great result considering that she did not use a water flosser. I'm not saying that Express is a replacement for water flossers, but the result is pretty amazing considering that she only brushed for 1.3 minutes. Another case, which I'm sure that a lot of you had the same scenario, this patient came to me and she told me that she did scaling in another clinic and that the doctor did not do a good job. But if you really look at it, it's only the right side of the jaws that is inflamed and the left side is healthy. So I asked her if she was right-handed, and she said yes. So that's why usually patients who are right-handed, when they start brushing the left side efficiently, and then they don't have time anymore and they don't brush equally both sides. So what I did nothing in the clinic. The only thing I did is that I gave her the proper oral hygiene instructions, and I asked her to focus on the gum stimulation head at night and the Express toothbrush in the morning. And this is the result we got after only 1 week and without me doing anything in the clinic. Another problem that we had is patients saying, I did not stick to my oral hygiene routine because I was traveling. I think a lot of you had that, right? Arta's solution was the mini water flosser. This is our #1 best-selling product. The mini water flosser is the smallest water flosser in the world that is smaller than the iPhone and smaller than the palms of the hand. You can basically put it in your pocket and take it on the go. The reason why I like it so much is that it's very important for patients who have braces, whether it's metal or clear aligners. It's also important for patients who have temporary prostheses. This patient came to me with temporary prostheses and inflamed gums, and I asked her to use the mini water flosser half an hour after each meal, and this is the result after 1 week. If you notice, especially on the lower jaw, the inflammation has subsided greatly. Another problem patients had, when patients say, ever since I started using clear aligners, my teeth stain more, my aligners turn yellow, and they have a very bad smell. Arta's solution for that is the ultrasonic cleaner. Dr. Sheirin told me that she really loves this device and that she uses it all the time. So what is amazing about the ultrasonic cleaner is that it's going to clean your items without having to do any kind of effort. You will just put the item for a maximum of 10 minutes, depending on the item, and it's going to do the cleaning for you using ultrasonic waves and vibrations. We took this device to a certified lab by the Ministry of Health in Kuwait, and they found out after several testing that it kills bacteria up to 97% without using anything else but water, which is a pretty great percentage. The ladies are going to love this. This is a makeup brush that haven't been cleaned for a while, and only after 10 minutes of using the ultrasonic cleaner without really doing anything, just putting the toothbrush in the device and turning it on for 10 minutes, and this is the result right after. We can also use the cleansing tabs along with the ultrasonic cleaner. They will give a nice minty, refreshing scent and odor, especially when the patient put back the aligners after brushing. And of course, it's going to kill more bacteria, but 97% is a pretty good percentage for me, but why not? This is a before and after of an aligner that has not been cleaned ever since the patient had it for more than a week. So what I do recommend when it comes to using the denture cleansing tablets is that you use it as a preventive to stop the staining of the aligners rather than whitening the aligners after they have already become yellow. Another patient problem that all of us, I think, always have that, is that they don't like using a soft toothbrush and they think that it's not cleaning very efficiently. And our solution for that is our famous golden toothbrush. Our toothbrush comes in ultra soft and soft, and what makes it really special is that the tip of the bristles is pointed, which is also gentle on the gums, and it cleans very efficiently between teeth and gums and between teeth, unlike the flat surface toothbrushes that will not go between teeth very effectively. I'm not saying that this is a replacement for the conventional dental floss, but I'm pretty sure that it cleans much better than a flat surface toothbrush. Do you see the contacts here in the picture? Another patient problem is I brush my teeth twice a day, I floss daily, I have no systemic diseases, but my breath still smells bad. Arta's solution for that is the tongue scraper. One of my favorite products, and this is actually the first products that we started with, what makes it better than brushing your tongue with a toothbrush? First of all, the tongue is the place that accumulates bacteria mostly, so we don't want to brush our tongue with the same toothbrush that we're brushing with our teeth because we don't want to transfer the bacteria. Second of all, if you use a brush to clean your tongue, then for sure you're going to be leaving some areas with bacterial load. But when it comes to the tongue scraper, you're going to take the whole area and you're going to scrape it off and you're going to clean the whole tongue. So this is a patient who came to me. This was actually the chief complaint of this patient, that she was brushing, flossing, but she still had a bad breath, and she felt great right after. And this is like only less than a minute difference. This is another patient who came to me with a black tongue because he was using a prolonged use of Clark City mouthwash. And he used it more than 2 weeks for some reason. Some patients really like Clark City mouthwash. So as you know, he had staining on his teeth. So this is right after, just a few minutes, like maybe, I guess less than 1 minute after using the tongue scraper. Another patient's problem, I don't like to floss because it hurts. Arta's solution for that was the PTFE dental floss. PTFE is known for being a monofilament floss. It's also covered with wax, so it's very easy to glide between teeth and gums where most plaque accumulates. So using it in the right way will definitely hurt less than using a silk floss. And the last product is when patients come to us and they don't understand what we're trying to explain to them. So they would say, "Doctor, I don't understand what you mean because I can't see what you're trying to explain to me." And Arta's solution for that was the Glow Pro mirror. It looks like a very simple product, but it took us more than 1 year to design this product. The reason why I wanted to create an illuminating mirror that can really help us see the details intraorally and extraorally and really help the patient understand what we are seeing as doctors and try to help them to understand more of their oral health so that we can reach to a treatment that is both good for the doctor and for the patients, because sometimes patients might not understand the clinical signs or even the treatment that you're trying to provide for them. So communication is very important, and this is why we created Glow Pro. I also thought about all the possible scenarios that we can use this device with. So you can use it hanged as well, because we provided a hanger with it. And it also comes with a stand, and the stand can also be used for an iPhone or a mobile, because a lot of girls now like to wear makeup while watching something. And also you can use it as handheld to really, just use it wherever you want. I even took it with me on my last trip because you don't know how the illumination of the place is. Thank you so much for today. If you have any questions, please let me know. And you can always follow us on Instagram. Me and my team will be more than happy to answer any of your inquiries. And if anyone has any requests for distributorship out of Kuwait, we'll be more than happy to receive your request as well. Thank you so much.
Thank you, Dr. Arta.
Thank you.
This is where the details really matter.
Yes.
And this is the combination between art and science. Thank you for sponsoring us today and having you today.
Thank you so much.
We will be here to honor you. And Dr. Mohammed, please.
يعطيك العافية دكتورة شيرين.
دكتورة، يعني
ما قصرت
محاضرة
التنسيق.
مميزة جدا جدا. أنا بصراحة اتبسطت جدا من فكرة البرزنتيشن، لأن أنت حبيتي تحطي السؤال المراجعين فعلا وشكوتهم، وإزاي أرتا قدرت بالديزاين وبالأرت إن هي تحل لهم المشكلة وتحسن من صحة الفم. فأنا نفسي اتبسطت جدا بالمحاضرة.
كان مهم صراحة بالنسبة لي أن تكون جدا بسيطة، نروح دايركت على مشاكل المراجعين، لأن هذا السبب الحقيقي لأرتا، أن إحنا نحاول نسهل عليهم العناية بصحة الفم والأسنان كثر ما نقدر، بحيث أن حتى هني الأطباء يستفيدون أكثر من المنتجات ويعرفون متى يوصفونهم حق المراجعين. ومثل ما شفتي المحاضرة كلها صور قبل وبعد، وأنا وايد يهمني هذا الشيء.
بجد يعني عجبتني النتائج اللي شفتها في السلايدز، إنه خلال أسبوع واحد في تحسن ملحوظ في الحالة. وزي ما قلتي دي الحتة اللي احنا فعلا محتاجينها في الأورال هايجين انستراكشنز بعد علاج أي مراجع، إن احنا نديله الإرشادات الصحيحة اللي يقدر من خلال المنتجات الصحيحة كمان الفعالة إن هو يوصل للنتيجة اللي عايزها. يعطيكي ألف عافية. أنا كمان أنتهز الفرصة أن أنا أشكر شركة آرتا والتيم وحضرتك على الدعم وعلى رعاية اليوم النهاردة أورال كيرن كانسر تريتمنت، واستغلينا الفرصة دي أن احنا يبقى فيها تبادل خبرات ويكون في رفع للوعي، ودايما نتمنى لآرتا التقدم ونشكركم على التواجد النهاردة، وأكيد احنا كمان داعمين ليكم.
يعطيك العافية دكتورة.
شكرا.
مزيد من التطور والنجاح.
شكرا دكتورة. شكرا، تشرفنا.